We're all told to be healthy, right? It seems like the simplest, most obviously good advice out there. But what if it's not that simple? What if I told you that hidden just beneath the surface of all that advice are some really tough ethical questions? Questions about freedom, about justice, and even about what kind of society we really want to build.
So, let's make this real. Let's talk about something pretty much everyone has an opinion on, a tax on sugary drinks. Is it a good idea? And believe it or not, how you answer that one simple question, it says a lot about your own personal philosophy.
Because the debate instantly splits right down the middle. On one side, you've got the argument for the greater good. Hey, it helps people make healthier choices, it saves lives, and it lowers costs for all of us. But on the other side, you get that immediate pushback. Whoa, hold on. This is the nanny state telling adults what to do and stepping on our personal freedom. And that tension, that's really at the heart of what we're talking about today.
And that's the thing, these arguments are never really just about soda. They're stand-ins for a much bigger fight. Every single health policy we create is built on some kind of hidden, unspoken vision of what a good society should be. What we value more, our collective health or our individual liberty, well, that shapes everything.
Okay, so let's actually look at these different blueprints. You can think of them as competing visions for how society should work, each one built around a completely different core value.
So this table really breaks it down for us. Let's take our soda tax and run it through these different filters. First up, you've got utilitarianism. All they care about is maximizing health for the most people. So they just ask, does the data show it works? Pretty straightforward, right? But then you have a libertarian, who's all about individual freedom. Their question is totally different. Is my soda hurting anyone else? If the answer is no, the government should butt out. Then there's justice as fairness. They focus on the least well-off, so they want to know if the tax actually helps the most disadvantaged people. And finally, you have solidarity, which says we're all in this together and have a shared duty to create a healthy community. So you see, one policy, four totally different ethical lenses.
But wait, it gets even trickier. All of these philosophies are about promoting health, but what do we actually mean by health? It seems like such an obvious word, but how we define it completely changes the goalposts for everything we do.
For a long time, this debate has been stuck between two extremes. On one hand, you've got the negative definition. It's super narrow, basically just saying health is when you're not sick. Then you've got the other extreme, the positive definition, from the World Health Organization. Health is a state of complete physical, mental, and social well-being. I mean, that sounds amazing, but it's also an impossible goal. Think about it. Under that definition, is anyone ever truly healthy?
So what's the solution? Well, the folks behind the research we're looking at today suggest a really practical middle ground. The idea is, let's keep the definition of health focused, like the absence of illness. But, and this part is absolutely crucial, we have to chase that goal inside a much bigger framework of overall well-being and social justice.
And this visual here just illustrates that idea perfectly. Health, as you can see, is just one piece of the pie. Things like personal security, being respected, having meaningful relationships, and having control over your own life. Those are just as essential to a good life. And here's the big takeaway. You should never, ever try to promote health in a way that stomps all over these other things. For example, a campaign that shames people who are overweight. Sure, it might be trying to improve health stats, but it's destroying other equally important parts of their well-being, like their sense of respect. And that's just not okay.
All right, so with that foundation laid, let's get down to the nitty-gritty. We're going to walk through 4 big ethical minefields that people in public health have to navigate every single day.
So, minefield number 1. This should sound familiar. It's that whole individual freedom thing we started with. You've got this really fine line, right? Between persuasion, which is just trying to convince you, and coercion, which is basically forcing you. And then you have that classic nanny state idea, paternalism, where the government steps in for your own good. Yeah, figuring out where that line is, it's really tough.
Minefield number 2 is one that's so easy to forget, especially in our super individualistic culture: collective goods. These are the big things, like clean air or safe food, that we all benefit from, but that none of us can create on our own. Look, your personal choices matter, for sure, but those choices don't happen in a vacuum, right? They happen in a world we all build together. And that idea really challenges the notion that health is just an individual thing.
And that leads us perfectly into our third minefield, which this question here just nails. Is it fair to hold individuals personally responsible for their health? This gets right to the heart of a huge and often really damaging problem: victim blaming.
Okay, to really get why this is so unfair, we have to understand this one key difference: causal responsibility versus moral responsibility. They are not the same thing.
Imagine this. You throw a party, you serve some food, but you had no idea it was contaminated. People get sick. Are you causally responsible? Well, yeah, you serve the food. But are you morally responsible? Are you to blame? Of course not. You didn't know. And it's the exact same thing with health. A person's actions might be a cause of their illness, sure, but when their choices are so limited by things they can't control, like where they live or how much money they make, it is just plain wrong to blame them for it.
And that's exactly what happens when we mix those two things up. Campaigns that focus too much on individual choice can end up creating more stigma, even if they don't mean to. And look, that's not just a feel-bad thing. It causes real, active harm. It goes right back to that chart we saw. It undermines a person's fundamental need for respect.
All right, this brings us to the final minefield. And honestly, this might be the most important one of all: fair distribution. It boils down to asking one very simple but very tough question. Who really benefits from this policy?
The hard reality is that people with the fewest advantages are often dealing with what experts call densely woven disadvantage. And it's such a good term because it's not just one thing. It's low income and bad housing and less education and no good grocery stores nearby, all of it tangled up together. And these problems don't just add up, they multiply each other, creating this huge systemic wall that makes it incredibly hard to be healthy.
And this chart, wow, it just lays out the result in black and white. A giant health gap. But here's the kicker, and this is so important to get. Many of our standard health tips, join a gym, buy organic, all that stuff is way, way easier for people with more money to do. And so here's the terrible irony. Sometimes our best intentions can actually make the problem worse. We can end up making that gap even wider.
Okay, so we've walked through all these minefields. Where does that leave us? How are we supposed to think about all this? Well, the goal here is to give you a new lens, a more ethical way to look at any health issue that comes up.
And here it is. It's basically a 3-question checklist. Super simple, but super powerful. First, what's the real goal? Are we just trying to move numbers on a chart, or are we trying to build a better, fairer society? Second, who could get hurt by this? Does it, even accidentally, blame or shame anyone? And third, and this is the big one, who benefits the most? Does it actually help close the gap for the people who need it most? If we start asking these questions, we're not just talking about health anymore, we're talking about justice.
Because at the end of the day, that's really what this is all about. If you take one thing away from all this, let it be this. Ethical health promotion, it's not just about crunching numbers and making people healthy. It is a moral mission. It's about building a fundamentally fairer society.
So I want to leave you with one last question to think about. If it's true, if our own health really depends on the community we create together, then what is our responsibility? Not just for ourselves, what is our responsibility to each other?